I'll start off with Sheila. So Sheila Fitzgerald's from Kerry. She has a background in nursing. I know her through the IPPOSI patient education program that we did, the pilot program together. So in 2015, Sheila was diagnosed with MS. And since then, she has brought both her professional background and her patient experience together to really work through and strengthen her patient advocacy that she's involved in. She's been involved in a few EHR initiatives with the HC, the Department of Health, as the patient representative, bringing the patient's voice into the development of EHRs. So Jackie Brown is also from Kerry. Got a strong Kerry component here today. And Jackie has over 30 years experience in disability activism and equality. She has also been through patient education experience with the IPPOSI program, and that's through this that I know Jackie. She's been involved in numerous boards and committees and been a member of lots of organisations with her through her activism, and she's also involved as a patient representative in EHR development within the HSE and the Department of Health. And then last but not least, we have Caroline Murphy. So Caroline's from Dundalk, and she got involved with EHRs through her experience with her son. So Caroline's son was diagnosed with epilepsy after an illness when he was 6. He's now 18. So she has extensive experience of being involved in his care from childhood to transition to an adult. And she's been fostering very strong relationships with the medical professionals. So she has experience with EHRs as being one of the few people in Ireland that has been involved in EHR already through the Epilepsy Lighthouse Project, and she can tell us more about that. So I'll start off with a question for Caroline. And so can you tell us a little bit about how you feel that EHRs can benefit the patient from your own experience and from what you've seen?
Obviously, as a parent of a child with an ongoing illness, anything that can help his care, I want to be involved in. 11 years, I suppose, in paediatric services where the hospital was small. We were known very well. We had built up wonderful relationships. And then the thought for many years even before that of having to move to this whole big bad world of adult services was always going to be a worry for me. So then we got involved in a transition program, which was wonderful as a parent, but for my son to get to know what it was going to be like in transitioning into adulthood, he needed to take more care of himself, that he needed to be more control of his illness, that it was now, it wasn't mommy that should be getting his medicines and all the rest. So that was all very much, and it was only later when we moved to the hospital I thought, but what about his records? He was so well prepared in, okay, when you meet the consultant now, it's that he's going to talk to you. He's not going to talk to your mom anymore. You have to have your questions all put out beforehand. You have to prepare for this 10-minute slot that you will get in the hospital. So you need to be. So, that was it. And then it was only, but what about his records? I mean, he has had a long illness of, 11 years. We've been to so many hospitals. We've seen so many different doctors. We've so many different areas of his care. I have 7 or 8 copybooks full of the information. And then I go and I'm asked, well, when did he have his first VNS battery put in? Oh, quick, which copy is that in? What about, when was he on the ketogenic diet? Because he has done all these things. And again, where is this information for me? In my copies somewhere, And I suppose, as a mother who's a little bit OTT with my son, it's fine. But I'm thinking now he's 18, he's going to be moving on, and he needs care for himself too, and to know. And what if he does want to travel, which I hope he will do? He needs something that he can take with him that lists, because as you can imagine, with a long-term illness like this, he has been on every anti-epileptic medicine that there is. He's had a VNS, he's had, so he needs to be able, he's not going to remember these things. It's enough for him to try and remember to take his tablets morning and night. And so it's become very important for me that Sean will have this information at his disposal. And so then when I was invited to get involved with the Lighthouse project, sorry, it was, yeah, great, fantastic. This is something that is badly needed. Now, I might say I'm the worst to get involved, maybe also the better, because I hate technology. I absolutely hate iPhones. I hate anything to do with it. So, they really have to sell this to me as something that, a dummy's guide to e-records are needed, because I'm really scared of all this. So maybe I'm the perfect person. But certainly seeing what is available and what can be done, and and I was very interested in your talk too, that tracking illnesses, and I just see that there has to be a way to, maybe for, Sean's been on all these medicines, they didn't work, but maybe another study will come up with, and that there is so much information that can be shared that is there, but it needs to be easy to get at, it needs to be updated, but it also needs, I talked earlier about Sean going to his appointments. It's not enough for him to prepare. I think too, this is where the clinician needs to quickly look into Sean's records and see, right, what kind of a month did you have, or since I've seen you last, that all of that should be there, because, as I say, you have a 10-minute appointment. So for both the patient and the clinician to get the most out of it, that, this is where the e-portal can really, should be of benefit to both. And I think, there is fantastic work certainly be done on the epilepsy portal, and there are so many areas. But, again, all his records need to be there, and training. So, yeah.
Yeah, that's great. Thank you, Caroline. So it really is not just on a healthcare side of things, but how it enables patients to really get on with the rest of their lives in ways that they don't have to be keeping track of things. Gives them a bit of freedom there.
Yes, you'd hope, yeah.
Thank you. All right, so the next question would be for Jackie, and we want to ask you about how EHRs can improve care and safety for patients.
Thank you very much. Thank you to the two previous speakers. First, I'm delighted to be here. I'm coming at this from the point of view of great hope, expectation. And for me, this is, as a patient, this is about improving my quality of life, giving me back time in my daily life that I don't have to spend keeping records. I could fill this room, at least, with my medical history. I've had more than 38, 39 surgeries. And apart from my age alone, I have a number of comorbidities. So my big problem is I am living with the reality of going to clinicians, experts in this country, elsewhere. I've had treatment in Germany, in Singapore, and most of my treatment's been in this country. But I'm still operating in silos. So I'm going around the country, mostly, bringing my data, my information, and updating all the clinicians I meet, because they don't know what the other is saying. When they prescribe something for me, I say, well, what about the interaction of that drug with this drug? I've had some adverse reactions to drugs because of lack of information. I have taken personal responsibility for managing my health. And I'm lucky I have the personal resources, the capacity, the willingness, and I don't get emotional about it. So I'm a very factual person, and just for the fun of it, I'm not obviously going to share it with you, but I have my 8-page summary medical record here in my hand. So that's what I now have in my Dropbox for when I go to visit, because anytime I end up in hospital, which on average is once every 3 months because of one of my comorbidities, they start asking your medical history, and I kind of cry. I say, first of all, you have it. So, well, what date was that surgery? I'm now beginning to mix up the dates of which surgery. I could tell you the number of hips and knees and shoulders I've had, but I myself can't remember exactly which year or which date. So I say, would you look at this? Here you go. There it is. I can email it to you as well if you want. I want to share my record. It's not just about me wanting to share, but I want to see this happen in this country. But the design of it has to be right. The burden is becoming too much for me. The older I get, we need a shared medical record. With all the data provisions, with all that, I have absolute faith in the GDPR process and the data management of it. I have no difficulty with that. But patients must be involved from the start. And I'm absolutely very pleased to hear you say, Deepak, patient engagement is not happening in this country sufficiently. I I've been at one meeting in the HSE, national meeting, in 1 year. That is not patient engagement.
You can keep it. Thank you very much, Jackie. That's fine. Thanks. I guess it's really coming through strongly that the patients really do want to be involved, and they are invested in this, obviously, in many ways, and they have voices that they actually want to be heard. Right. So now we'll talk to Sheila about our next question, and it kind of bridges the gap between the paper and the electronic, and it's a question really about, is everything all sorted once we go electronic, or is there an underlying current of change that needs to happen as well?
I think patients want to engage, and they want to exercise their human rights to autonomy and self-determination. I think that's really important. I think information is key in this, and I think they need open access to their healthcare records. I think there has been some cultural change in Ireland involving more patient engagement, but I think a lot more has to occur. I think if we are going to have an adequate system that works with electronic healthcare records, if we're going to implement Sloan to Care, if we're going to have patient-centred care, then this needs to happen. I think technology in the form of electronic records may enable things, but it will not cause the cultural change to happen of itself. And I think that is really important. I think patients are concerned that electronic patient records will deliver better, safer care. That is their primary concern. I say, and they're right to be concerned, because we know that 1 in 10 patients in a hospital suffer an adverse event. And the World Health Organization, looking at this statistic, has said that the greater patient involvement is a key to safer care. They have also pointed out that patient involvement is not expensive, and it delivers economic results as well as improved care. So you would wonder, in a system that's stretched, why are we not doing something that is beneficial? I think there's a business case. I think there's a human rights case for patient involvement in record sharing, facilitated by technology and aided by an appropriate culture of trust. I think, in answer to your question, we're on the road of cultural change, but we still have many reluctant travellers.
Thank you, Sheila. I suppose you covered a lot of different aspects of it there, that it's not just a simple case of having the technology. It actually needs cultural change to really get the best out of it, and also to ensure patients actually can get the best out of their healthcare for it. So I think in the interest of time, we'll come to our final question for everybody. And that's really that, with some of the examples that Vincent spoke about earlier, and there are some other ones, such as the Epilepsy Lighthouse Project, that there are some shining examples of positive nuggets of EHR going on in Ireland, but they tend to be disease specific. And so the general question is, what really needs to be worked through to get EHRs to the level in Ireland that we really need them to be working, so that we can get to the level where actual clinical research can happen, as well as improving healthcare. Sheila, if you want to start.
Okay, I think internationally there's been a professional reluctance. I think in almost every country, the healthcare professionals have, retreated to sort of protectionism, an anxiety to protect, I would say an over-anxiety to protect patients. I think even if that is valid in limited circumstances, it should not be the norm. It should not be the norm that we're out there. Part of your job is actually not to protect patients. Well, it's to protect patients, but it's not to do so by denying them access to information. I think, secondly, frequently, requests for information patients are seen as difficult or challenging. That it's seen as a challenge to the system, rather than somebody maybe like Jackie inquiring about something so that they can take it on to the next person who may not have received the information. you know. I think another aspect of the challenges that we face is the area that when patients request access to records, it's often seen as the first step in a legal action, a legal challenge. I think that sort of defence, it breeds a defensiveness on the part of healthcare professionals, and that defensiveness creates suspicion in patients that they haven't received appropriate care. I think that whole era of defensiveness causes sort of, suspicion and lack of trust. And I think we should have learned that what the Irish healthcare system really does need to do is build trust with our patients. So I think, it really is important that we look at appropriate sharing of information, and that we are less afraid about why patients are requesting it, or what they might do to it, I think, or how much protection they need.
Thanks, Sheila. Okay, I'll put the question to Caroline. What do you think needs to be done yet?
Yeah, I think because we live in a culture of litigation. I mean, I think I can see it there, and people are afraid to come. But I think the most important thing I would see is the building of relationship between patient and consultant first. I think that, if there is the relationship there, well then, it's not going to be seen as, oh, I'm trying to, catch you out on something, because it's not. I mean, anyone that's here, anyone that wants why do you want the records? It's because you're obviously going to look at them a lot more. You're there to try and help the person who's sick, or yourself, or whatever else. So, you're not starting off from let's try, you're saying, right, how can we make this better? In my case, for my son, and I think it's about being in good relationship, but getting there. And, the project that the Lighthouse Project, talking to patients, what do we want on the e-portal? Like, what is there? It's to make life easier, as if for the patient, but also for the consultant, that they can see things, and that it is a working together relationship, and that is the important thing, that, and that the questions, and that's why it is so good to be involved from the beginning of this project, of, what as patients should be on it. It's not just about the medical, it's what we feel is important, like what affects my son on day to day in his medical condition. And, I think that's so important, and that's, I definitely would commend the Lighthouse Project on that there is so much, coming back to the patient. How is it working? How are you finding this? I'm having problems with the IT. Well, let's see how we can sort that. And, I think going from there. But, I mean, it has to be, trust between them. It's not a matter of catching somebody out. It's to make my son's care the best possible care I can get for him. And I'm quite sure that the consultant is for the same. But I'm going to spot something that, could be overlooked. It won't be overlooked by me, because I've only the one file, and I will be, scanning it. So if it's there on my e-portal, I will see it. And, but that the right information, that we get the right information from the word go on the portals.
Okay, thank you, Caroline. And Jackie, finally?
I think as well, I think we should be focusing as much, if not more, on the benefits of doing this right, and of the benefits of involving patients from the outset, just as long as Caroline said, because we want to do to improve our own lives, or our children's lives, in the case of minors and things like that, or indeed for somebody who maybe an older person whose capacity might be in question, somebody else, a significant person in their life, might be wanting to. So this is about looking at the benefits of having an e-record, so that we're improving the quality of life for people, apart from the whole mitigating risk around safety patients and safety issues and things like that, and the cost. There's no doubt in my mind that we will reduce costs. If we can reduce paper, it's good for the environment. There's so many benefits. I mean, you could sit here for the day and just start listing off benefits. And that's apart from the whole research thing and looking at research to discover. And I really like that point, and I think that's really important that we highlight that, the value of it. And obviously, the very last thing I would say, obviously, speaking with my disability hat, we must remember to make sure it's accessible from get-go. That means signing, means accessible language, it means accessible computer software for people who are blind, visually impaired, the whole gamut of access tools. But rather than retrofitting after the event, too late and more expensive.
Thanks, Jackie. You can hold on to that. All right. So I guess there's a strong message there that, like, really this is a great opportunity in Ireland, that we are at the start. And some might see that, like, we're starting a bit late compared to other countries, but we've got a great opportunity to actually start it correctly and to have the right voices there from the start and to build a really strong EHR system across our hospitals and with the right stakeholders involved. Okay, so on that, I will ask our two speakers from earlier to join us up on the panel, and we can have a question and answer session.